All right, guys, today we have this gorgeous patient here. It's a bit of a challenging case. We're doing liposuction 360, Vaser 360, and a fat transfer to the butt, but it's not for volume. It's really just to change shape. You can see the hip dips that she has here, and that's her only problem. So we're going to use a small cannula to do the liposuction, collect that fat, and fill in the hip dips. Let's get the case started. Start the case, of course, with doing what's called tumescing the abdomen. It's a combination of sodium bicarb, lidocaine, epinephrine, and of course saline to help decrease bleeding, decrease pain. All right, guys, so we've already done all of our tumescence in the front. Now we're starting the case out by using Vaser ultrasound, which is going to help break up any fibrous tissue that she has and sort of shake up the fat, makes it easier to collect. All right, guys, so now we've done our Vaser already. We're starting to collect the fat. We're using a small cannula, it's a 4. I'm probably going to downsize to a 3 even, to help collect the fat. It's so skinny and we don't need much. We just need enough to fill in those hip dips, maybe add just a little bit to her projection. All right, guys, this is our gorgeous patient here today. We're doing a skinny BBL. We've already done the front, including Vaser. We've turned the back side, so now we're going to focus on the love handle areas to really give the butt much better shape. Collect the fat, do Vaser, of course, liposuction, and then fill in those hip dips with the BBL. Let's finish off the case. Alright, guys, so we're starting the case, of course, by tumescing all of the fat that we're going to be liposuctioning. Combination of lidocaine, epinephrine, sodium bicarb, and saline decreases pain and bleeding. Alright, guys, so the next step after tumescing, of course, is using the Vaser. It's especially important on the back, and especially important in skinny patients. Helps break up all the fibrous tissues so that the liposuction is nice and smooth. Alright, guys, part of our safe BBL is placing the fat on top of the muscle. That's what I'm using my left hand for, the feel, where we're going to be injecting the fat. Inject it very carefully with a basket cannula. First step, and really for her, it's mostly changing the shape of her butt and filling in these hip dips. Alright, guys, our gorgeous patient here today doing a skinny BBL. It's really not about the projection as much as it's the shape. She didn't like the hip dips that she had and the love handles above that. So what did we do? We did Vaser 360, liposuction 360 with a BBL, and here's her final result. You see she's got nice hourglass shape, a little bit of swelling, and look at those hips. There's no love handles whatsoever. We did add some for the projection here, and the hip dips are completely filled in. She is Scottsdale snatched.